Top 5 recommendations to avoid post-shockwave treatment. Number 1, strenuous or high activity on the treated area, if you're not used to it. So we're going to avoid things for 24 to 48 hours, including running, jumping, heavy lifting, sports, or any movements that stress or load the treated tendon or muscle significantly. Light walking is fine, but take it easy to allow the microtrauma healing process to begin. Again, that's if you are not used to those things. Number 2, anti-inflammatory medications or NSAIDs. Skip those for 48 hours, including Advil, Aleve, aspirin, topical NSAIDs, or anything similar to those. They can blunt the beneficial inflammatory response that Shockwave is trying to start. Number 3, ice application for the first 48 hours. Avoid icing the treated area, which normally can help with acute swelling and many injuries, but it can counteract the healing cascade promoted by Shockwave. Heat is also generally avoided in the immediate window, but would be preferred over icing in this example. Number 4, alcohol consumption. Limit or avoid alcohol for at least 24 to 48 hours. It's going to promote dehydration and increase inflammation, which is then going to slow recovery. Number 5, ignoring pain or overdoing it too soon. Don't push through significant discomfort or resume full activity before your body is ready. Some soreness or mild bruising is normal for a few days. It's just part of the process. So keep those things in mind and see you in the office.